Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now, calcium channel blockers, in them first we will see the dihydropyridines. So these dihydropyridines are mostly used in hypertension. They are most widely used in hypertension, okay, and they are least cardioselective. These dihydropyridines are least cardioselective and they have better or greater effect is present on the peripheral resistance. So because they have better effect on the peripheral resistance, these will decrease the peripheral vascular resistance. Because of the decreased peripheral vascular resistance, there will be decrease in both afterload and preload, and thus they can be used in hypertension. So they are better used in hypertension. Because of their least cardioselective nature, they also have less cardiac side effects also. So the mechanism of action of dihydropyridines. So dihydropyridines are actually vasodilators. Their vasodilatory action in the arteries is more than that of veins. These will reduce the peripheral vascular resistance, and because of the reduction of peripheral vascular resistance, the blood pressure also decreases. These will mainly block the L type of calcium channels, because this will block the L type of calcium channels which are present in the blood vessels and the heart, and thus they cause relaxation of blood vessels, leading to, because of relaxation of blood vessels, this will result in reduced peripheral vascular resistance is seen, and this reduced peripheral vascular resistance is responsible for decreasing the blood pressure in the patient. Now,
thank you and thank you for watching.